definitions of medication errors, then epidemiology, classification of medication errors, then causes of medication errors. After that, I will discuss about the some factors which are involved or contribute to the medications errors, and at the last, I will discuss about the prevent how to prevent the medications errors or how to overcome these type medications errors. So coming to the definitions, this medication error is any type of preventable event that may cause or that may lead to the inappropriate medications use or that patients harm when the medication is in control of the healthcare professional, a patient or consumers. These medication errors may occur at any time from the prescription to the administration of the medicines or drugs by the patient. So the problems and sources of medications errors are multidisciplinary and multifactorial, that is depending on the patient, depending on the healthcare professionals, depending on the pharmaceutical cares, or depending on the dose, depending on the route of administrations. So the errors that are normally occurs from the lack of knowledge about the medicines to the pharmacist or to the healthcare professionals or to the patients. It's maybe due to the unclear labeling of drugs. Sometimes the label is not clear, right? Drugs name, manufacturing date, expiry date, batch number, that may lead to the medications errors. Next is the misidentification of patient or disease. If suppose patients have the infections of bacteria like a gram positive infections, if the doctor or physician is giving the antibiotics that only inhibits the gram negative bacteria, so that is the misidentifications of the disease. So it may be occurs these errors may be occurs due to the both experience as well as inexperienced staff. So depend on the knowledge, depend on the experience also, it can be happen. So next is the epidemiology. There is the one interesting fact: more people in United States of America was die in the given year as a result of medication errors rather than from the motor vehicle accidents, breast cancer, or HIV/AIDS. So the majority of medications errors are occurs normally. So in India, Indian study of the pediatric intensive care unit, they reported that 68.5% of all errors they are happens due to the medication errors. So these are the some causes of medications errors like errors of omissions. These errors related to the prescription. That errors may be related to the drug dispensing by the pharmacist or by the registered pharmacist. Drug administration by the medical personnel like nurses or patient themselves, that may causes the errors. Next is the errors of commissions. Most common form of the errors in the clinical practice that include the wrong phenomena, a wrong drug, wrong route of administration, wrong patient, or maybe a drug interaction related, drug interaction, drug food, or maybe drug disease interactions. Next is the communication failure between the patient and providers. Next is the failure to follow the appropriate policies, which is related to the drug use. Next is the failure to follow the drug specific instructions by the pharmacist, by the physician, or by the patient. So next, last, these errors of commission is the overuse of drug, that is the irrational use of antibiotics, irrational use of the drugs, or by we can say polypharmacy. If the patient is taking more than two medicine at the same time, that is known as the polypharmacy. The first one is the wrong phenomena, that including the wrong drug, wrong dose, wrong substitutions for the drug, a wrong patient, a wrong regimen, and wrong route of administrations that may lead to the medications error. Next is the drug interactions related syrup, that is drug interactions, or maybe drug food interactions, or interactive with the other alternative form of medicines like natural products, Ayurveda, Siddha medicines. They are responsible for medications error, which may lead to the some serious adverse drug reaction, serious adverse drug events. Sometimes there is a requirement of hospitalizations, and sometimes there is the death of the patients may happen due to the drug interactions. So next is the communication failure. It is a process that failure during the process of patient's management or during the patient counseling. Suppose pharmacist or any physician giving the informations about the medicines, and that patient is unable to understand the term, unable to understand the language. So that may lead to the medications errors. So include the illegible or illegible type of handwriting, we can say bad handwriting, or incomplete prescribing orders. These are the some examples of the communications failure in term. This is the bad handwriting. You can see this is very difficult to understand what physician had written in these particular prescriptions. So common errors that includes the G mistakes for the MG. Sometimes if the medicines have the uh, 4 mg, and if the by mistakes this physicians or patients or sorry pharmacist give on the 4 gram in case of 4 mg, then that may causes the death of the patients or any adverse drug reactions in the patient. Sometimes 4 mistakes for the 4 u decimal point, like a zero point 0.1 that reads as a 1. That is the one example of medications errors. So next is the some other recognized type of medications errors, like incomplete patient's informations, like patient name, patient surname, name, age of the patient, gender, body weight, medication history. That may lead to the medications errors. Next is the drug informations unavailable in the drug information center or in the pharmacopoeia. That may causes the medications error. Next is the miscommunications of the drug orders or confusion in the drug names. That is the example is the LASA drugs. Then misuse of zeros and some decimal points in the prescription. Confusion in the dosing units or inappropriate abbreviations, which is commonly used in the prescription, that may causes the medication errors in the uh, patient. So these are the types of errors, like prescribing type of error, dispensing type of errors, and administration type of errors. Coming to the prescribing errors, it is the incorrect due to the incorrect drug selections for the patient, that may causes the prescribing type of errors, or errors in the quantity or indications, that may lead to the prescribing type of errors, and prescribing contraindicated drugs to the patient or to the pregnant woman, that may causes the prescribing type of errors. So there are some factors which are involved in the prescribing type of errors, like lack of knowledge of the prescribed medicines, prescribed drugs, prescribed dose, and patient details, that lead to the prescribing type of errors. Next is the bad handwriting. I already saw the photos of these bad handwritings. Next is the inaccurate medication history taking by the healthcare professionals, that may lead to the prescribing and other type of errors. Next is the confusion with the drug name, LASA drugs, inappropriate use of decimal points like zero point 0.1 or 1. And next is the use of some abbreviations that also lead to the medications errors. Next is the use of some verbal orders that lead to the administration type of errors. So this is the example of bad handwriting. You can see in these slides, you cannot understand anything what actually that physicians has written in this particular area prescriptions. So that may lead to the medications error. So, what are the risk factor for prescribing errors? That include the work environment and workload of the physician, workload of the pharmacy. Next is the miscommunications within the team, like nurses or physician, pharmacist, dentist, that may lead to the prescribing type of errors. Next is the physical or mental well-beings, a lack of knowledge to the pharmacist, to the physician, that may lead to the prescribing type of errors. Maybe inadequate training to the physicians or to the pharmacist, or absence of self-awareness about the errors. These are the factors for the prescribing errors. So how to reduce the prescribing errors? We can use the some digital type of prescribing methods. You can see in this slide, like this is the digital type of prescribing methods. Here we have mentioned the name, address, city, date of birth, then medicines like hydrochlorothiazides, then dose of these, and the formulation that may be in the capsule or in the tablet, and which route we can use, like mouth or by the intravenous. And these all things have mentioned this uh, in the this particular prescriptions. So this is the computerized physician order entry system that eliminates the need for transcriptions ordered by the nursing staffs. You can see there is the medicines name, you can entry number of medicines, how many medicines need to take. These all things include in the computerized physician's order entry system to minimize the adverse drug reaction. Next is the dispensing errors that receive the physician supply by the dispense medications to the patient, and it occurs primarily with drug having the similar name or abbreviations, like that is the LASA drugs. There is the one example, like that is the Lexis and Losic. The Lexis consists of the furosemide, and this Losic consists of the omeprazole. The mechanism of actions, the uses of these both medicines are different. So other potential dispensing errors that include the wrong dose, or wrong drug, or wrong patient. So these are the some examples, as well as the part of the dispensing errors. So how to reduce the dispensing error? We can ensure the safe dispensing procedures as per the guidelines of government. Then we can separating the drug with similar name or appearance, so that there is the less chances of confusion regarding the medicines. We can use the unit dose medication dispensing to the patients. Next, automated medication dispensing system also we can use, and we can use the barcode medications for dispensing as well as administrations of the medicines to the patient. So these are the some methods which reduce the dispensing errors in the patient, like unit dose medication system. We can use the barcode, we can use the automated medication dispensing system. This is the administration's errors, that is a occurs after the dispensing of medicines to the patient and the patients. And the errors of omissions, the drug is not administered. So incorrect administration techniques, especially for the uh, parentals, or for the as a aerosols medicines for the treatment of asthma and COPD, or administration of incorrect or expired medicines, expired preparations, that causes the administration type of errors. So deliver the some violence of the guidelines, so that is a that causes the administration type of errors. So contributing factors like failure to check the patient's identify prior to the administration to the patient, or maybe some environmental factors such as some noise or interruptions, or maybe some poor lighting, that is contribute to the administration type of errors. Next is the wrong calculations to determine the correct dose. Like there are, as you know, that number of methods are used to determine, to calculate the dose, like Young or dealing methods. So as per these calculations, we should give the dose to the patient. Reducing administration's errors, we can checking the patient identify, ensuring dosage calculations are cross-checked by the experienced persons or other healthcare professionals before drug is given or administration to the patient, especially anesthetic medicines. Ensuring medication given at correct time, correct route, correct dose, and minimize the interpretations drug during the drug rounds, so the we can so that we can reduce the administration type of errors. So there are some drugs which are commonly associated with medication errors like analgesics, unnecessary use of some opioid analgesic that causes the sedation in the patients like morphine, tramadol, heroin. These medicines have the some uh, medications errors. Next is the that errors reported are due to the wrong route of administrations. Next is the failure to monitor the clinical parameters like blood pressure or heart rate of the patient, respiratory of the patients, that result in the major adverse drug reactions, which are outcomes related to the opioid use to the patient. So these are the some commonly uh, the common type of drugs that causes the medications error, analgesic, especially opioid analgesics. Some antibiotics causes, that is the irrational use of the antibiotics causes the medications error, as well as uh, antibiotic resistance in the patient. Next is the anticoagulant medicines, inadequate therapeutic dosing, or failure to monitor the blood levels that causes the medications errors, or maybe some cardiovascular agents which is used for the treatment of cardiac disease like angina pectoris, or maybe myocardial infarctions, or maybe arrhythmia or other disease, or hypertensions also, that errors due to the overdose of the medicines, or we can failure to identify the drug interactions due to the polypharmacy. If the patients have the more than two disease, and during that time physicians may prescribe the more than two drugs also, so there is the chances of drug interactions in the particular disease. Diabetic medications over dose of drugs that may causes the hypoglycemia, for example insulin, that may causes the hypoglycemia in the patient. So over use if the patient is trying to keep blood glucose within the normal limits, we should give the uh, fixed dose of insulin to the patient. Next is the failure to take drugs in the relation to the meals. This group of the drugs that signifies importance of the patient educations by uh, treating by the physicians. So next heading is the look or like, sound or like, that is the LASA drugs, which existence of confusing drug name is one of the most common causes of medication error. With thousands of drugs currently in market, and they are potential for the error due to the confusing drug names in its significance. So there are the some contributing factors like bad handwriting or incomplete knowledge about the drugs names, newly available products which does not have the any safety profile or efficacy profile, similar packaging or labeling of the medicines, similar clinical use, or similar strength, dosage form, frequency of administrations. So these are the some factors which causes the medication errors. So major effect on the therapeutic success, you can see the brand name and generic name of the medicines, like for example benzool and benzool. So this benzool consists of the danzol, and the benzool consists of the albendazole. So this is the different category of the medicines. Next is the alprazoles, all that consist of the alprazolam, and next is the edrazoles, that is consist of the omeprazole. The therapeutic use of these medicines is different. So next is the omsat and amset up. Then omsat that consists of the ampicillin, but in case of amset that consists of the amlodipine, and the use of these medicines are different. So this is the minor effect on therapeutic success, like furosemide and hydrochlorothiazide. The mechanism actions of these both drugs are different, but the therapeutic use are the same. These both are used as a diuretics medicines. like Disprin and Dospin. In the Disprin consists of the aspirin 350 mg and dose pin that consists of the aspirin 75 mg. This Disprin is used as a analgesic, antipyretic, and anti-inflammatory, but the dose pin as a used as the antiplatelets. There is a no significant effect on the therapeutic success. Like you can see the etmox and etrox. That etmox is consists of the amoxicillin, and this consists the azithromycin. So both are clinically used for the treatment of bacterial infections. So this is the example of no significant effect on the therapeutic success type of medication errors. So in the diagram also you can see there is the some medications errors like gabapentin tablet or other type of brozil type of medicines. So this is the due to this common label, similar label you can see. Yeah. So this may lead to the medication error in the patient. So, how to prevent medication errors by LASA drugs? We can use the novel dosage delivery devices to distinguish product with similar names. So we can print the generic and brand names on unit dose packing when it is possible. We can use the Tallman letter to minimize the spelling of the drug names or to minimize the any type of adverse drug reactions. We can use the like lamivudine and lamotrigine. You can see this is the tall example of tall man lettering system. You can see this lamivudine and lamotrigine. The therapeutic use of the both medicines are different. That includes the dosing limit for the medications with similar indications also. The next is the role of regulatory authorities to improve the medications either. First one is the it is important. It play the importance role in the preventing medications errors by review the drug labels and nomenclatures that enhance the preventive strategy in the patient. Next is the FDA provides the guidance to industry to maintenance proper drugs labels as per the Food and Drug Administrations. Public educations by regulatory agency improve the medications use. They can conduct the various seminars. They can conduct the various training to the patient, to the healthcare providers, so that that could help to reduce or improve the medications use in the patient. Next is the role of organizations. The computer software installations by Food and Drug Administration to analyze the similar drugs names. Next, it also play the importance role in the potential confusion names rejected. Then FDA reviews the 300 brand names in a year before they are marketed to avoid the confusion of LASA drugs. And the FDA also encourages the some pharmacists and other healthcare professional to report any medications errors to the Food and Drug Administration office. Next is the role of prescriber. The doctors should have some knowledge about the generic names and brand names of available drugs in their local settings. They can also specify the dose forms, drug strength, and complete directions on the prescriptions. They can also using the both brand as well as uh, generic name on the prescriptions. They have also mentioned the purpose of the medications and that handwriting should be good so that pharmacist should understand the prescription. Next is the role of pharmacists. They refer back to doctor if any confusions in the prescription. If they thought there is the drug interactions or if the drug have the contraindications to the patients, they can refer back to doctor. Uh, and the basic knowledge of dosing regimens for the commonly used drug as a pharmacist they should know. They can strict the alert in area where the LASA drugs are stored. They have give this some alert or they can give this some stickers so that we can uh, know the we we should know these drugs are the LASA drugs. So in case of wrong prescription, pharmacists should not react in front of the patients. Just they can refer back to the doctors rather than change their facial expression. Next is the role of nursing staff to prevent the medication errors. Uh, they can educate and proper training importance in reducing the medications related errors. Most errors don't reach patients because of barrier role play the importance roles by the nurse. So independent calculation of pediatrics dose by more than one person should be there. So should be aware about the storage requirement for the drugs. For example, if there is some parental products, or for example there is the insulin or other products, so the storage is play the importance roles. Next is the patient and physician educations. Regular short courses training to the junior resident by academic institutional for the good medical writing practice. So prescribers should also consider the prescriber should also consider the age of the patient, any physical disability in the patient of the patient, weak eye, or there is a problem in the eye of the patient before prescribing. These all things you should keep in your mind. So next is the patient educate regarding the correct use of prescription or over the counter medications. So this type of education should be conducted. Patients should confirm the name and strength of prescribed drugs before leaving the doctor office or before leaving the pharmacist shop. So they should confirm. So educate the about the storage conditions of drugs for like biological products or the other products, because as you know that number the biological products we should storage at the cold temperature, that is the between 2.2 to 8 degrees Celsius. So keeping medicines away from the reach of children also should be uh, informed to the informed to the patient. So patients should carry all previous prescriptions history to avoid the repeating use of the medicines. Uh, so these are the some references from where I have taken these materials. Uh, and these are the some important questions like definitions of medications errors, categorization of medications error with example, classifications of medications errors. What are the factors that influencing the medications errors? Next question is what are the medications error? Explain the role of pharmacy in the prevention of medications error. And the last question is what are the different type of medication error? Explain the each medications error with example. So give two example of LASA drugs. Describe the administration type of errors. Role of pharmacy in the prevention of management of medication errors. Write any five example of dispensing type of errors. Give five example of LASA drugs. So in this particular video, I have discussed about the what is medication error and definition, some epidemiology. Then after that, I have discussed about the classifications like prescribing type, dispensing type, and administration type of class. Then after that, I also discuss about the some factors which are contributing to the medications error. And after that, at the last of the lecture, I discussed about the how to prevent the medications errors. So I hope you understand the particular lecture. So I hope you like also, and thank you very much for watching this video. uh, Once again, thank you so much.